Today I will be performing a coronal dental polishing procedure. After scaling, polishing helps remove surface stains and smooth the enamel. I had started in the upper right quadrant working on the buccal surfaces, applying a small amount of paste, making sure we get the whole surface. The instrument used is a handpiece with a rubber prophy cup and polishing paste. Throughout this procedure, I consistently use light pressure to keep the cup moving to prevent heat buildup. As I have finished the upper left and right quadrant, I then slowly move to the lingual surface, which is in the back and it faces toward your tongue. You may need to adjust when moving from one part to another part of the tooth depending on what surface you are working from and what quadrant you are working from. As I had finished both upper quadrants and surfaces of the teeth, I then slowly moved to the bottom. Starting from the lower right quadrant, I do the same steps, which were facial to lingual to occlusal surfaces of the teeth. Using both hands is always helpful as you may need to move the lip just a little bit. Always making sure the patient is comfortable while the procedure is happening. After completing the polishing in all quadrants and all surfaces of the teeth, I thoroughly rinse the patient's mouth and suction to remove any paste. Sometimes the paste can get a little bit on their mouth, so I always try to make the patient comfortable by wiping it down. After rinsing and wiping down the patient, the next step is to floss. Flossing between all teeth is very important to remove any remaining debris and paste. While flossing, I gently slide the floss beneath the contact area, moving it up and down along the tooth surface, making sure I am using both hands and wrapping the used floss around my finger and using a clean part between each tooth. Moving and angling your hands is very important for the comfort of the patient and to make sure you get the remaining debris and paste. After I finish flossing the patient's teeth, I like to re-rinse the patient's mouth. After polishing and flossing the patient's teeth, I provide them with a Paradox rinse to help bacteria and support gingival health. I apply it all around and instruct the patient not to swallow, to hold for a little before suctioning.